Now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
And thank you so much, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Before we continue with our discussion, I do need to remind everyone that Cape Fear Valley offers Alzheimer's they offer an Alzheimer's support group, actually two of them. One, they meet the third Tuesday of each month, and that's over at the Medical Arts Center on Robinson Street. And they also meet the second they also meet at the second location, every first Wednesday of the month, and that's at Harmony of Hope Mills, which is located over on Rockfish Road. Now, if you know of someone who needs an Alzheimer's support group, or maybe you have a friend or a family member, what you need to do is contact or reach out and call 910-615-1781. That's 615-1781. Ladies and gentlemen, in the middle of a fantastic conversation about hearts. We're talking about the real hearts, not the hearts that everybody is going to go buy tomorrow to get out of the doghouse. So with us right now, Cardiopulmonary Rehabilitation Nurse, Miss Genavie Ahmad. We also have with us today Education Coordinator for Cardiac Services, Rachel Thurnher, and we have Dr. DePaola from Cape Fear Cardiology Associates with us today. Now, Dr. DePaola, before we went into break, we were about to we were about to talk a little bit more about specific recommendations for women and at different ages. So beyond the basics that Ms. Ahmad talked about earlier, what else can women and men, I'll put them in the conversation too.
We can include them.
Well, we were talking about women. But anyway, what can they do to lower their risk of heart disease and improve their heart health?
Sure. So again, as I mentioned a little bit earlier, just taking the time to actually go see a doctor and making sure they're getting annual assessments on your cholesterol, checking and making sure you don't have diabetes, making sure that they go over, the understanding of the importance of diet and exercise and those sorts of things. Unfortunately, for breast cancer, we have mammograms. Mm-hmm. For colorectal cancer, we have colonoscopies. There's really no screening for coronary disease per se. We don't have one specific test in order to help us better understand what might be going on. So that's why it's super important to make sure that you are seeing a provider regularly to make sure that those things that we know increase risk are being well addressed and being managed.
Ms. Thurnher, let's talk about treatments. By the time a patient, they get to see you, they already have issues. So what are some of the treatments for heart disease, and do women see different treatments than men?
Well, the goal would be to prevent things from getting worse, mm-hmm. and to fix what we can fix. So going from probably least invasive to most invasive after lifestyle modifications like Dr. DePaola mentioned, we're talking about medications. Some things can be medically managed, blood pressure lowering medications, cholesterol lowering medications. And then if those aren't doing the trick, we have a little more invasive where we can bring you to the cardiac cath lab, actually go up inside the body into the heart, and we can try and restore blood flow within the coronary arteries with stenting or angioplasty, actually opening up those vessels, mm-hmm. helping keep those open. The next step would be open heart surgery, coronary artery bypass grafting, where we actually have to go around the blockage in the vessel with a graft to kind of create a new road for the blood to flow around the issue. Mm-hmm. And generally, I would say that the treatments for men and women in those areas tend to be the same. There might be some slight medication differences. Really, the biggest differences that I've found in my research is that men tend to have more obstructive disease, where they actually have plaque buildup and blockages, and women it tends to be more small vessel disease, meaning that the actual anatomy is slightly different. We tend to have thinner ventricular walls in the heart, and we tend to have more smaller vessels coming off the coronary arteries. And the issue with that is that microvasculature, when the issues lie there, it's harder to diagnose than an obstructive disease. So women, as we've already mentioned, might get diagnosed later, and so then thereby they might be treated a little later. And the final step is going to be cardiac rehab, which, again, the treatment's generally the same for men and women, but we all know women probably tend to say, I am too busy to go do that. I'm not going to take the time out. So I think Genavie can talk a little bit more about cardiac rehab, but it would be encouraged for both genders equally.
Genavie, let's talk about cardiac rehab, because I was one of those that
Did you go?
I'm sorry, what did I say?
I'm putting you on the spot. Did you go? Did we call you? I knew it. Okay.
You didn't have to call me out like that. No, ma'am, I did not. I
Okay.
did go, but then I got embarrassed because everyone in there, they were older than I was.
Oh.
And they kept looking at me like, why are you here? Why aren't you taking better care of yourself? And then it was like, I'm not going back because I get beat up. So I
Well, I'm sorry that you had that experience. We see young people in our cardiac rehab program all the time, so you would not have been an odd man out. We would never shame you there, ever, okay? We have a good time in cardiac rehab, all right? So basically what cardiac rehab is, it is a individualized treatment plan that helps you with the lifestyle modification bit, that part that all of us struggle with, right? So it's a 3-month dedicated thing that you got to do. So that's where that time component comes in. 3 days a week for like 2 hours each time you come in. Total of 36 sessions. Most insurances do cover it. Medicare covers it at like 80%.
Wow.
Most regular insurances do cover it at about 80%. The VA covers it 100% if you get authorization. So does TRICARE. So it's a great program to go to. To qualify, you have to have had either a heart attack, angioplasty, stenting, bypass surgery, heart failure if your EF's less than 35%, any kind of valve surgery, so think TAVR, aortic valve replacement, standard, done the standard way as well, mitral valve, tricuspid valve, any of those valves being messed with, you can come to see us. So it's a great program. It's actually a class 1 evidence-based guideline recommendation, part of the AMI, like evidence-based practice. This is the best practice for these patients. The problem with women in cardiac rehab, as you just stated, is y'all don't come.
Did she say? She said y'all.
So the stats on that is that over the last 3 decades, greater than 80% of eligible women do not come to cardiac rehab, or they attempt cardiac rehab and do not complete it. So that's a problem. You know, and the reason behind it, you said it yourself. I got busy, or I was embarrassed, or you know, I have family obligations. You know, I don't have the time. And I have that conversation with women a lot. You need to make the time. Your health is the most important. I know that you're
That
taking
is
care
true.
of people, but you got to remember, if you're not there to take care of them, what you gonna do?
That's true.
So we love to help you with that. We not only help with the exercise component, we also do nutrition counseling as well. We help with that psychological component of heart disease. Anxiety and depression is really major after having a heart event, and so we really do try to work on that. Stress management techniques, ways to manage that stress in a healthy way, and then just kind of really drilling down that you've got to stay on top of those comorbidities, high blood pressure, high cholesterol, diabetes. Go to your doctor's appointments, do all the things you're supposed to be doing.
Yeah.
Yeah. So
The
it's a great
accountability
program.
part of it is huge.
Yeah, it's great. And you get that camaraderie because you meet people that have been through very similar things. And you're able to kind of build those relationships. I had one class of patients, and they are best friends. They
Wow.
go to Zaxby's, but they
You could have left that out.
I know, but they go out to eat regularly with
But
each
they
other.
had a
have-
salad.
They did. They had the salad, the grilled salad. So I'll take it. Right? But they did. They went. They go out. They have you know, get-togethers with each other all the time, and it's wonderful to see that. So it's just great.
You mentioned something that made me think about internalizing stress. And this is pretty much open for whichever one of you that want to jump in, because this isn't one of the questions that were already there. My cardiologist drills me about internalizing stress. Well, he did. He doesn't really get on me too much now because I'm doing everything that I'm supposed to do since Darvin passed away. But he was always on me about internalizing stress and how serious internalizing stress is and how internalizing stress can kill you. Explain to our listeners and our viewers what that is. And whichever one of you want to talk, go ahead.
I'll take that.
Sure, go for it.
Here's the thing. I mean, stress is undeniable. Every one of us has it. Everyone in this room has it. It's just not a man thing, it's a woman thing too, because more women are entering the workforce, and then they put that on their plate along with childcare on their plate, taking care of their spouse on that plate, taking care of mom and dad on that place, and everything else that comes with it. It's just how we go about handling that stress is the most important. So, finding time to take care of yourself is the most important. Saying after a dinner, I'm going to clean the dishes and I'm going to go take that walk. Not that it's cardiovascularly a good thing, but it helps you kind of unwind from your day so that you can get a better night's sleep. Because we know people that don't sleep well are also manifesting problems down the line too. It's like kicking the can. And so, maybe for someone else, it's, retreating and meeting up with a group of friends. Maybe for others, it's just taking a warm bath. It's just carving that time out for yourself. And unfortunately, as women, we oftentimes find ourselves feeling selfish because we're taking that time. But again, as Genevieve mentioned, if you're not taking care of yourself, how does all that other stuff get done? And so that's why you have to make that a priority, a bigger priority sometimes than some of the other things, because if you're not getting yourself taken care of, nothing else is either.
Can I say something as well
Yes,
to add
go
to
ahead.
that? Anecdotally, I started having chest pain years ago when I first moved to Fayetteville. I was starting grad school. I had 2 young children. I was on the hunt for a job, setting up a new house, military spouse, lots of things I was excited about. And when I went to my primary care doctor, like a good patient, because I had symptoms, he said, the body doesn't differentiate between positive stress and negative stress. Wow. So I thought, I don't feel stressed. I'm so excited about grad school. I'm excited about, this new house and these new experiences. But all my body was experiencing was stress, whether it was things I was excited about or not. So this multitasking, this feeling that women especially have, that we have to do all the things, it's not, even if we're excited about it, it's not necessarily the best for our health. So really just slowing down, prioritizing, focusing on 1 or 2 things at a time on your to-do list, not 25, can really be helpful as well. Delegating. Ooh, good word.
I call it taking off the cape, folding it up, and putting it on the shelf. That's what I call it. Dr. DePaola, I read this, and I got into my feelings when I read this. I read that researchers have found that bystanders are less likely to administer CPR to women than men. And that seems a little dude for me. First of all, why is that? And second, what would you tell someone who is hesitant to help a woman who is suffering from a cardiac episode?
Right. I don't know. I've never experienced that myself personally. I mean, I think as a physician, if I'm working in the emergency room, if something's happening, I'm always going to be there to render a helping hand. And I've never come across a situation where there's a crowd of people going, oh, this woman's laying here, I'm not going to do anything. But I think there is some trepidation just in general when it comes to helping out for fear of not knowing what to do. So in other words, someone knows that they know to do CPR, they just don't know how to do it effectively or correctly. And then there's that fear of, if I do it wrong, I'll make things worse. So I know Cape Fear Valley has had an initiative in the community itself to help educate those in the community with hands-only CPR. I know Genevieve is very pivotal in helping with that as well too. So I think knowledge in the community is especially important. I also think there's always a little bit of trepidation when it comes to, a guy standing over a woman and we're administering CPR, is there being some sort of aggression being held there? Or, you know, oh gosh, if I don't do this correctly, someone's going to see me, put it on YouTube and like, oh, look at that guy, he's assaulting that woman. No, he's trying to help save her life. And so I think those are other fundamental causes. I think that should be lower on the priority of concern. I think a lot of it is just not knowing how to help in the right way and the fear of making it worse. At the bare minimum, just call 911 and get somebody there to help. Go to their side, you know, check a pulse, see what's going on. Maybe it's not as bad as you think, but you won't know until you at least go and check and see what's going on.
And to add to that, because I'm also really involved in our Heart Center's hands-on CPR outreach.
Yes.
We always like to tell our people that we're teaching that you're protected in all 50 states under the Good Samaritan law, meaning that if you try to do CPR, you try to do chest compressions and you do them wrong, you end up, you know, not going deep enough, or you break ribs, which does happen, especially in our elderly population. You puncture a lung, or the person just doesn't survive. You cannot be sued for trying to help. You were there with the intent to try to save a life. So it's always better, even if you're not entirely sure how to do it, to try to do something. If you do nothing, they're dead, right? They don't have a heartbeat. So always try is what we try to teach people in that instance.
Rachel, how do we set up a hands-only CPR? I mean, give us the details about that.
Sure, you can call me. So yes, I, along with my boss, Benjamin Beeson, we're in charge of the Heart Center's outreach program. So you can I give my contact info here?
Go ahead.
Okay, so you can call me, reach out to me at 703-638-3991, or you can email me at rthurnher@capefearvalley.com. That's RTHURNHER@capefearvalley.com. You can also just call the hospital, call the Heart Center front desk, and they can get you pointed in the right direction. And we do it completely for free. There's no catch, no gimmicks. I know people think nothing is free these days, but we will come to you and give you a presentation completely for free on how to save lives, because that's how important this is, and that's how passionate we are about it.
Awesome. Ladies, do you think that our society needs to talk more about stress in a woman's life and how it can impact her heart health?
Yes, 100%, absolutely.
Mm-hmm.
So I think I was just through that. I'm sorry. Okay, Ms. Ahmad, I've heard doctors explain that heart issues fall into two big categories, and they were described as, and I thought this was so interesting, they were described as plumbing and electricity. Are women more likely to have one of those issues over the other one?
Ooh, that's a good question for Dr. DePaola.
I was thinking you were going to turn that to me. So no, I think they are equal in their presentations. You know, I have on any given day someone who comes in with complaint of palpitations or heart irregularities, which would fall in the electrical category. And then I have other people that come in to see me with complaint of shortness of breath and chest pain, which was more of a plumbing issue. So I don't think there's necessarily a percentage of those that come and seek for their concerns. I think it's equal in its presentation. And as a result, there's different pathways in which to work these things up. It's not always just a simple, oh, let's just do a stress test. Sometimes it's a little bit more, oh, let's do a monitor for you for a couple of days, or let's get an echocardiogram to make sure structurally there isn't a problem. So depending on their presentation and the symptoms they're telling me will sort of depend on how I go about working them up from one thing or the other. It's pretty unusual that you see them come cross paths, but oftentimes they will. Like coronary artery disease can sometimes present itself as atrial fibrillation, but those are oftentimes more rare in occurrence. But oftentimes they're often separate and treated differently.
All right, ladies, before we close out today's broadcast, let's go around the table. Dr. DePaola, Ms. Ahmad, Ms. Thurnher, a closing message or a thought for our listeners that you want them to take away from this discussion today?
I would say don't wait. Time is heart muscle. So if you have any concerns that you think you might be having an issue with your heart, better safe than sorry. Call 911, go to the emergency department.
All right.
I want women to know that it is not selfish to take your health and make it a priority.
The people in the back did not hear you. Could you say that again, please?
It is not selfish for you to make your health and yourself a priority.
Did you hear that? Okay. Dr. DePaola?
And once you come to that conclusion, that's when you reach out to your provider, whether that be your primary care provider or you just want to get a self-referral for a cardiac assessment. You got to pick up the phone and make it happen. And so, like I said before, ignoring things and living in denial never serves you well. So always take that time, take that opportunity, make yourself first for once, and do the right thing and get the treatment that you need.
And let me add, you'll get over that guilt. Ladies and gentlemen, that wraps up another edition of Cape Fear Valley Helps Making Rounds Live. Ladies, thank you so much for being with us today. This has been amazing. Family, please join me once again in thanking Cardiopulmonary Rehabilitation Nurse Genavie Ahmad, Education Coordinator for Cardiac Services for Cape Fear Valley Health, Rachel Thurnher, and Dr. Brenda DePaola from Cape Fear Valley Cardiology Associates. Now, make sure you all have a fantastic Valentine's Day tomorrow, and remember to take care of your heart health every day so you can have another romantic Heart Day. And our next broadcast is Tuesday, February 27th, so make sure you mark that down. And we'll continue our focus on heart health and hypertension, and we're going to talk more about heart issues. So like I said, make sure you join us. For our producers, Shaka Jordan, Lindsey Graham, and Ray Thomas, and the team behind the scenes, I'm Omega Jones, continuing the legacy for Darvin Jones. Thanks for listening to Cape Fear Valley Health's Making Rounds Live.
Your station for inspiration and information, 1600 AM, 99.7